Our approach at NHS Kernow has really been to look at how we can change the culture across Cornwall, working with our partners and the public to co-design new services and create new relationships. I think we've used the opportunity of a new commissioning group to enable us to do that and bring new energy into perhaps what was quite a set system. And we've centred services around patients' needs. So the urgent care centre that we recently developed came on the back of many years of the public marching on the streets about the closure of their new hospital. But what we've been able to do is create a very positive new hospital that they have confidence in by co-designing it with them. I think the main barriers have been really people's willingness to change and how you create that culture that people feel they can change and they're not constrained by what's gone on before. So we've developed a number of ways of doing that. We've brought all the leaders across the system together in a leadership summit, which is chief executives, chairs, the whole system in a room together to discuss and agree the priorities across Cornwall. We've also involved the voluntary and community sector in developing what community services and linking them in. I think they've always been on the periphery, but we've been able to engage with them. I think the other enablers have been engaging with clinical staff at all levels and managers and bringing them together to solve a problem together, so to build new relationships across the system. So some small wins really where they feel they can make a difference. Because when I talk to clinicians and managers, what they want to do is make a difference for people. They want that freedom to act and they want to be empowered. We have been really careful, I think, to make sure that we can measure our success, and we've used the triple aim methodology that the Institute for Healthcare Improvement in Boston have introduced. So we look at things from a patient experience perspective, the safety and quality of services, and also the resources that we're using. So that's why I can say the work in UK, we can demonstrate how that has affected people's lives. We know emergency admissions have gone down in that area. And we know for an investment of £1, we're getting a £4 return on that investment. We're absolutely delighted that we've been chosen as one of the pioneer communities. So Cornwall, I feel, is now on the map. It has enabled people to coalesce around that now. There's a real energy and determination that we will make a difference in Cornwall. I think very early on, build the relationships, create that new culture for people, create that energy, develop things together. That co-creation really develops trust. It really develops those relationships. And I think as leaders, if we can stop some of the noise going down the system, create that space for people to innovate, that's really important.